Secretary Becerra, thank you so much for taking the time to speak with Scripps News on such an important day. Let's start, of course, with this big announcement. Tell me about these 15 drugs that have been selected for drug negotiations and what savings might mean for Part D recipients.
Jacob, this is the second year of implementation of President Biden's signature lower cost prescription drug law, where we get to, for the first time in history, negotiate lower drug prices within the Medicare program. We proved it works last year when we took the 10 most expensive drugs. By the way, of the some thousands, about 8,000 drugs that Medicare covers, we took just the top 10. And just those top 10 drugs cost about $50 billion or more a year for the Medicare beneficiaries who need them. And so that's not the whole population of Medicare, just those who need that particular drug, those drugs. That's how expensive these are, those 10. We were able to lower the price, a list price of those drugs through our negotiations from 40 to 80% over the list price. That meant a savings of billions of dollars out of the pockets of so many Medicare beneficiaries and taxpayers. Round 2 started now. This announcement of 15 net new drugs adds to the 10 from last year. And so together, those 25 drugs, just those 25 out of the thousands of drugs in Medicare, constitute about a third of all the spending by Medicare on drugs. And so we negotiate good prices for these next 15. We're in good shape for the American people and for Medicare beneficiaries.
This announcement is coming less than a week before the new administration takes over on January 20th. Are you confident that President-elect Trump and his team will continue these negotiations after you leave office?
I'm absolutely confident that using our roadmap, anyone coming into this administration can have success because it's simply a matter of negotiating. We see the facts. We see the prices. We see how much we're paying. There's a lot of running space in between to lower prices. So am I confident that we can have success as we proved last year? Well, we proved it last year. And round 2, we've announced the drugs. It will be left to the next administration to do the negotiations. But there's a clear roadmap for success for the American people and for Medicare beneficiaries. And I guarantee you, Medicare beneficiaries want to see us lower the prices that they're paying for their medications.
Several of the biggest drug manufacturers and pharmaceutical companies have already gone public with their ask to President-elect Trump and his administration to pause the negotiation process. Have you discussed this at all with President-elect Trump's pick for the next HHS Secretary, RFK Jr.? And again, just sort of broadly, you mentioned that they have a roadmap that they could do this, but do you feel like they actually will?
Well, surprise, surprise, the drug companies would like to pause the negotiation, which lets us get better prices for the people who have to use those drugs. They're making billions of dollars on those drugs, and they don't want to change the price. I'm shocked. I'm shocked that they don't want to change the price. Look, it's the law. Whether they want it or not, it's the law. And now it's up to the next administration to negotiate better prices. It's not their decision to not do it. At some point, they'll have to disclose the process they used to do it. And as I said, we'll have something to compare it to because we did round 1 and we succeeded beyond most people's expectations. No reason why round 2 shouldn't be just as successful, if not more. And because now we've seen what works, we've seen how these prices are set, and we know that we're paying way more than the rest of the world for these drugs. And we should not be the piggy bank for the pharmaceutical companies because we need those drugs.
Thinking about that list of 15 drugs that were announced today, some of the biggest GLP-3s like Ozempic are on that list. But currently, Medicare Part D does not cover those drugs for things like obesity and weight loss purposes, only for conditions like diabetes. I know the Biden administration, under your leadership, helped to propose a rule change to cover weight loss. Do you have a sense as to whether the next administration will finalize that change and allow those drugs, these perhaps newly lowered prices drugs, to be used for weight loss purposes?
And Jacob, just a quick clarification. We didn't propose a rule so that you could include weight loss. We proposed a rule so you could include obesity, which is now more and more recognized in the medical community as a disease. By law, Medicare cannot pay for drugs that are geared for weight loss. And so we have Ozempic already available through the Medicare program for folks who have, for example, diabetes, because some of these drugs treat diabetes. They've also been shown to help with obesity and help people lose weight, because one of the things you find in diabetes and obviously obesity by definition is that people are overweight. And so what we're simply saying is we've let the science and the facts take us where we should go. And so these drugs are now being covered because the science has taken us there, and the way Congress set up the law and required us to go after the drugs that are most expensive, we're now able to negotiate. What happens from there? Again, the roadmap is clear. Jacob's, no, this is as close to having training wheels on your bicycle as you can get.
I want to ask you about another sort of newsy item today, which is that President Biden announced he's going to recognize the ratification of the Equal Rights Amendment. First, just broadly, is that a move you support?
Well, I've always supported the Equal Rights Amendment, and here at the Department of Health and Human Services, we've done everything we could to defend a woman's right to access the reproductive health care she needs. And so is that something that I think is worth this country doing and consummating? Absolutely. I would love to see us be able to treat each other with the same respect, the same dignity, and have the same rights as anyone else. And the Equal Rights Amendment just simply says that. Everyone should have equal rights. So that to me is as straightforward as it can get.
You mentioned your efforts, the department's efforts to protect abortion access and reproductive care in the wake of Roe's reversal. Should women expect this new amendment, if it stands, to change at all the impact of some of those health-related matters?
Well, I hope women recognize that they need champions in Congress, in the executive branch, and throughout the state legislatures and governor's offices in order to have their rights protected. We found out a few years ago how quickly things that we take for granted, the rights that we have, can disappear. Today, my daughters, who are in their 20s, have fewer rights to access the care that they need than did their mother, which is a crazy thought. I've always grown up believing that America makes progress. We always do things better. We learn from our mistakes and perfect it. Here, it seems like we went backwards. And I got to tell you, the majority of Americans don't like that we went backwards on reproductive rights. But 6 people decided for 333 million people what rights we had. And that, to me, is a travesty.
So just to clarify on that, are there any implications from a healthcare perspective from the Equal Rights Amendment being ratified to the Constitution?
Well, if it were ratified, and there are many steps that have to take place for it to be ratified, then certainly it would provide expanded protection from current law for women, including in healthcare. And so would a decision like the Dobbs decision that overturned Roe be possible? Maybe legal experts would debate, but it's hard to believe you have equal rights to the care that you need if you're a woman, if you can't access all aspects of care that you need. That men don't have to bear babies, it doesn't mean that they have a right to say to a woman that that's not a right that you should have to deal with your reproductive health. And so, look, I think it's pretty straightforward. That's one of the reasons why the Equal Rights Amendment would be so important, because to this day, we continue to abridge the rights of some Americans simply because of who they are.
I'd love to just ask a couple more questions broadly about, your 4 years in this role. Today's what I assume to be your last weekday in office. What would you say has been your biggest challenge leading the department?
But lots of challenges, but it's always something you look forward to waking up to do, because what you're doing is leaving America healthier and stronger by taking on these challenges. I do have to say that it's the things that you can't see that probably worry me the most. I don't think any one of us has ever seen the COVID vaccine, the COVID virus directly, but it sure did a tremendous job upending this country and this economy. I don't think anyone has seen the bug that attacked the healthcare sector and Change Healthcare and the United Healthcare subsidiary that caused the entire sector of health to go down, because not the entire, but almost the entire sector to go down because they couldn't interact because of that cyber attack. That cyber attack cost billions of dollars, and it stopped the exchange of medical data. A patient needs to have an operation. Doctor couldn't get that information to the hospital because that cyber attack brought down those electronic functions. You couldn't get bills paid. Doctors provide services. They can't bill the insurer because the electronic data can't be exchanged. Those types of attacks are serious, and we can't see them. And we have to get ready because more and more the health sector is being the victim of cyber attacks. More and more we're finding that biological attacks are reaching our shores. And of course the man-made attacks could be really dangerous too if somebody tries to send out some type of anthrax or something that could kill a lot of people. So little things that we can never see that can cause big problems that probably worry me the most. Otherwise, I think our ingenuity and our hardworking, talented folks at HHS and throughout the health sector are there to help America stay healthy and strong.
You mentioned the pandemic. Of course, you assumed this role sort of in the heat of one of the worst public health crises in recent history. The pandemic has largely receded, but trust in America's health agencies sort of remains historically low, despite a number of the actions that President Biden, yourself, other health leaders have taken. What do you think explains why Americans are so distrustful of HHS, CDC, public health leaders?
Well, first, I always think it's good to check and verify, right? It's always good for you to go into something believing that you want to ensure for yourself that it's the real deal. You know, no one wants to buy that car that's a lemon. And it used to be the case that we didn't have any laws that protected you against buying those cars. Now you've got lemon laws throughout the country. So it's always good to have a healthy dose of skepticism. The difficulty is that today with social media and access to information instantaneously, you get a lot of information, much of it of which is not true, which makes it difficult for people to discern the facts and decide what's true and not. That's what makes it tough. At the end of the day, I think people will be comforted if they drive that car and it functions well, it's not a lemon. Well, if these vaccines are saving lives, I think most people will say, I should get vaccinated. And you'll always have that noise that's out there. We just have to be discerning to figure out what's right, what's wrong. Hopefully we're all out there trying to pass out facts so we can combat that disinformation.
You mentioned social media and your concerns about misinformation and disinformation before. In recent weeks, we've seen a number of tech companies take steps to further limit the ability of fact-checking, eliminating it in even some cases, and sort of taking this broad approach in favor of free speech that eliminates some of those safeguards for some of those concerns you mentioned. What impact do you think that will have on our health specifically?
Well, we all have responsibilities, individuals, public responsibilities. My responsibility is to make sure that the information we're dispensing at HHS and the type of work that we're doing will benefit people, will elevate their health. And so we all have a responsibility. Those who control these social media platforms have responsibilities as well. They're giving people a platform. That's not my realm, so I'm not going to say to you what precisely their 5 points of responsibility, 10 points of responsibility are. All I can tell you is they have an obligation to be responsible, just the way any small business vendor who's selling, a merchant who's selling you, whether it's toys or prescription medication, they've got a responsibility as well. We all have responsibilities. I know what my responsibility is. My responsibility is to make sure that we abide by the laws and we provide Americans with the right information and the right tools to stay healthy and be stronger.
Last couple of questions. President Biden has promised a seamless and smooth transition to the next administration. As a part of that, have you met with Robert F. Kennedy Jr., and what were those conversations like?
I individually have not met with the transition individuals. Remember that the transition is occurring as we speak, and the conversation principally takes place with the folks in government who will stay. We have 95,000 people in the Department of Health and Human Services. Very few of us are appointed by the president, those of us who are appointed will be moving on. So when the transition teams typically speak to the people who are going to stay on, because they're going to continue that conversation once those folks in the transition become the actual next administration. And so most of the conversation, we've had conversations with the Trump transition team, but most of those conversations are taking place with our folks who are going to be in place when the new administration comes in.
More broadly, then, do you have any advice for anyone who might succeed you in this role with the benefit of hindsight having served here?
Yeah, I do. Most important, execute. Our job is to execute. We get to do policy. We get to try to steer things in a particular direction. But at the end of the day, the president gets to make those calls, and our job is to execute. And I believe that with more Americans with health insurance coverage today than ever in the history of the country, more than 300 million, with the Affordable Care Act breaking records all 4 years that we were here, we broke a record in the number of people who got their health insurance through the ACA marketplace, now at about 24 million. With the work that we did on behavioral health, setting up the 988 suicide and prevention crisis line, all those things that we did, I think we executed. And I would just really urge the next secretary and the personnel coming in to execute, because there is no time to waste, whether it's because of the next viral infection or the next cyber attack. We have to be ready. You have to know how to execute.
Lastly, your term comes to an end in just a few days. What's next for you? And is there any truth to the speculation that you might be considering pursuing a gubernatorial run in California when Gavin Newsom's term ends?
Yeah, so I've been very fortunate. I've had a chance to go to places I've wanted to be and try to do things where I can make a difference. And so I still have some years in me. I'm going to try to make a difference in wherever I go. And until I'm out of this job, Jacob, all I can tell you is I'm Secretary of the Department of Health and Human Services, because I'm not interested in violating any laws talking about what I'm going to be doing, because I can only be secretary while I'm secretary. And in a few days, I will no longer be secretary. I'll be able to talk a little bit more fluidly and comfortably and publicly. But I'm not done. Lots of opportunities. I know I've been approached, but I've had to tell everyone, stay tuned, pause, stay tuned until I'm out of this position. I can't talk about those things.
You're leaving office at a time of great opportunities in healthcare, but also great challenges, flu pandemics, mental health concerns, climate change-induced extreme weather events. Just broadly, are you optimistic about the future of our nation's health?
I am. I really am. And part of it's because I'm the son of immigrants. I always tell people optimism runs in your DNA when you're a child of immigrants. And I've seen also what we can do together. The talent that we have at HHS, the professionals that are out there in the private sector working hard. Healthcare is a place where all signs are going up that we can do better. Now, certainly COVID took us down quite a bit, but we recovered. And so that's the beauty, and that's why I have the optimism, is because we figure it out. We figure out how to do this, and we try to make it happen and get it done. And so I have great faith that the health professionals and the experts in this field are going to work hard regardless of what comes at them. We just have to have the support to get it done. And so when someone says, we think we have a great new medicine or therapy that can help keep people alive, I hope Congress is listening, and I hope the American people support, because in order to get these things done, you got to put fuel in the tank, and that's where we can do some miraculous things if we got fuel in the tank.
Anything I didn't ask you about that you wanted to mention or highlight?
We covered a lot of ground, a lot of opportunity. As I said, we're leaving this country healthier and stronger than when we found it 4 years ago, and I think that's the best thing we can do. As I said, I try to find a job where I can make a big difference. Well, if we're leaving America healthier and stronger than when we found it, I think we've made a difference.
Well, Mr. Secretary, thank you so much for taking the time to chat. I really appreciated it.
Jacob, thank you very much.